Nigeria is inching closer to achieving the 15% health budget benchmark set by the Abuja Declaration in 2001. In what appears to be a bold move to prioritize healthcare, President Bola Ahmed Tinubu announced a 2.48 trillion naira allocation to the health sector during the presentation of the 2025 appropriation bill at the National Assembly. Correspondent Base Itayebang looks deeper into the prospects of this rather ambitious budget.
Steady progress wins the race, they say, and Nigeria's health sector seems to be living proof. From standing tall in the face of crises like Ebola and COVID-19 to carving out a spot in the nation's annual budget, there is no denying that though slow, but strides are being made. Take the 2025 appropriation bill, for instance. With 2.48 trillion naira allocated to healthcare, it's clear there is a renewed drive to put the system on a high gear.
It simply means that the president is walking his talk.
Let's look closer to see where the allocation is heading. 402 billion naira goes into healthcare infrastructure development, while 282.65 billion heads to the Basic Healthcare Provisions Fund. This year's allocation more than doubles last year's, which was 125 billion naira. It's a step up from 1.38 trillion allocated in 2024 financial year.
That's something positive, even though it is still a far cry from where we should be.
President Bola Ahmed Tinubu called the budget ambitious, but noted that it is a necessary leap to secure the future of healthcare in Nigeria. The president's vision is to build stronger primary healthcare, revitalize hospitals, as well as access to quality care for all Nigerians.
Back on implementing the 2025 budget, our steps are deliberate, our decisions resolute, and our priorities are clear.
Still, if we take a walk down memory lane to 1999, when democracy returned, it's clear this journey hasn't been smooth. Back then in 1999, the health budget was a modest 15.2 billion. Fast forward to 2010, it grew to 120 billion naira, 257 billion naira in 2015, and 547 billion by 2021. And yet, even with this record high 2025 figure, we are still far from the 15% benchmark set by the Abuja Declaration in 2001. Experts agree a renewed focus on healthcare is commendable, but it's not there just yet.
I would say cautious optimism for me in terms of this budget, because we don't know how much will be released if the National Assembly passes the 2.48 trillion.
Maternal mortality, communicable diseases, and underfunded facilities remain hurdles too big to ignore. And the warning is clear: shrinking health budget in the future could throw a hinder to our ambitious plans for universal health care and better outcomes.
We have hundreds and thousands of primary healthcare centers in various states under the local government areas. How many of these can we confidently say that if I go there, a proper testing for malaria can be done?
As the saying goes, the journey of 1,000 miles begins with a single step. The 2025 budget may represent several steps forward, but as Bongos Ikwe once asked in his timeless lyrics, will we ever get there? Will we ever make it? The question remains, will these efforts truly transform healthcare in Nigeria? In Abuja, Basi Taipan, NTA News.